When COVID-19 hit the population, prior to COVID, we had really high quality test kits that we used for testing HIV or hepatitis. Each country has regulations that require the manufacturer to provide the regulator or the government evidence that the test kit works. However, when COVID started, because of the nature of the pandemic, the manufacturers, the regulators required the manufacturers only to give a small amount of evidence to show that their test kits worked. This allowed lots of test kits to come onto the market, and within 5 months of the COVID epidemic, we had more than 700 COVID test kits that were available for use. But this was a really short period of time to get good test kits onto the market. So what were the consequences of this situation? What happened is obviously a lot of not particularly good test kits were able to be used, and this caused problems in the results of the test kits being false positives or false negatives. We also found that that the governments bought up a lot of these test kits, so the supply of those test kits were quite limited, particularly in low and middle income countries. Also, what we found in the scientific community is that there were a lot of publications about how good these test kits are, which varied in nature. We had lots of test kits evaluations that showed the same test kits. Some said the test kit was really good, others said it was not that good. And this was because the evaluation of those test kits were not really well structured, and the journals allowed publications that were not peer reviewed. There were some really good evaluations, and what happened is those evaluations were the sorts of evaluations that we need in future pandemics. When we have the next pandemic, what we really need is government funding to have established evaluation laboratories all around the world in high income, middle income, and in low income countries. We also need to have evaluation laboratories in the northern and southern hemispheres. We need to be able to share samples, to collect samples, and to have established agreements so that those samples and those test kits can be moved across borders really quickly. We need standard protocols, and more importantly, we need a clinical interface to collect really well-characterized samples. And if we can get that in place, then we'll be in a much better place to react to the next pandemic.